Welcome to the Gerontological Society of America's series, Connecting the Immunization and Aging Communities, supported by Pfizer. In our first session, we'll be getting to know the Advisory Committee on Immunization Practices, or ACIP. Our objectives for today are twofold. First, to elucidate the purpose and structure of the ACIP, and second, to share ways to engage with ACIP on issues related to older adult vaccination. Once you know more about the committee, we hope that you feel comfortable sharing the views and needs of older adults with this group. As you'll hear throughout this presentation, there are several structured ways to engage with the committee and many opportunities to increase the representation of issues unique to older adults. We've already mentioned ACIP several times, so what exactly is it? ACIP is a federal advisory committee created by the Public Health Service Act and governed by the Federal Advisory Committee Act. The members of the committee advise the director of the CDC, who in turn informs the HHS secretary or acting secretary on recommendations for how vaccines are to be used in the U.S. civilian population. Being a federal advisory committee means that notices of their meetings are published in the Federal Register and are typically open to the public. Meetings traditionally happen 3 times a year in February, June, and October in Atlanta at the CDC, with some exception. For example, the committee has been meeting virtually and on an emergency basis in 2020 and 2021 due to the COVID-19 pandemic. Whether in person or virtual, the meetings are broadcast live on the CDC website. Committee members are supported by CDC staff assigned by the Office of the Director from the National Center for Immunization and Respiratory Diseases. Of note, ACIP is not the FDA, which reviews the quality, safety, and effectiveness of vaccines in development and decides whether to approve a license. The members of the Advisory Committee on Immunization Practices make several types of decisions. First, they provide advice for the civilian population, not the military, for the control of diseases for which a vaccine is licensed in the United States. Second, they provide recommendations for the use of vaccines, immune globulin preparations, and/or antimicrobial therapy shown to be effective in controlling a disease for which a vaccine is available. Third, they provide guidance for use of vaccines approved by the FDA under an emergency use authorization if circumstances warrant. To recap, they focus on diseases for which vaccines are available and recommendations for how to use vaccines and other biologics to control those diseases. To break it down a bit further, for each vaccine they consider, the committee advises which groups or circumstances warrant a vaccine recommendation. They also provide recommendations on contraindications and precautions, which is a list of conditions or groups that should not get vaccinated or should wait to be vaccinated. These are usually lists of people with specific medical conditions who may have a reaction or for whom the vaccine will not be effective. And finally, they provide information on recognized adverse events, everything from sore arms to rare events. They study the connection between the reported reaction and the vaccine, modify the recommendations if needed, and share that information with the public. In addition to giving recommendations on specific vaccines, the ACIP committee members might also address the general use of vaccines and immune globulin, as well as special situations or populations that may warrant a modification of the routine recommendations. For example, the ACIP creates the recommended childhood, adolescent, and adult immunization schedules. They also think about broad health conditions like diabetes, and what vaccines may be best for people who have diabetes, separate from the routine recommendations for the general population. All of this may sound highly technical and perhaps important only to certain people, but their decisions do matter to many groups. For example, recommendations for immunizations from ACIP create first dollar coverage requirements as part of the Affordable Care Act. Through Section 1928 of the Social Security Act, ACIP decides which vaccines are included through the Vaccines for Children program, which provides vaccines at no cost to over half of US children. Practitioners look to ACIP for guidance about when to use specific vaccines or what to do in special circumstances. Insurance companies often conform their coverage to ACIP recommendations. And finally, open public meetings allow great transparency for all aspects of vaccine policymaking, including vaccine safety concerns. Now we know what ACIP is, a formal federal advisory committee, what kinds of decisions they make about vaccines and the diseases vaccines control, and why those decisions matter. Let's talk now about who is on ACIP and making those decisions. Broadly, ACIP is made up of one chairperson and 14 members who have overlapping 4-year terms. Those 15 individuals come from the fields of pediatric and adult immunization practice and public health and have expertise in one of several areas: the use of vaccines and other immunobiologic agents in clinical practice or preventive medicine, clinical or laboratory vaccine research, assessment of vaccine efficacy and safety, and epidemiological assessment of the impact of vaccine use in large populations. One of the members of the committee is a consumer representative, a person knowledgeable about consumer perspectives and/or social and community aspects of immunization programs. When the ACIP meets in person, this group makes a U shape of seating in the center of the room. The people who comprise the committee bring their unique experiences and expertise to the recommendation and voting process, which is why it's helpful to understand that only one of the committee member positions is dedicated to someone with older adult medical expertise. There are also non-voting ex officio members from various government agencies. While many important groups are represented in this list, including the National Institutes of Health, National Institute on Aging is not explicitly one of them. Ex officio members are typically seated outside of the U shape of committee members, making up one side of an outer U. Many professional and academic societies have been designated as non-voting liaison representative members. You'll note here that the American College of Physicians is represented, whose members care for many older adults, but American Geriatric Society is the only one explicitly dedicated to aging issues. When the ACIP meets in person, the non-voting liaisons sit around the ACIP members, forming the bottom and second side of the outer U. The liaison representatives can fully participate in the discussions. Now we've discussed what ACIP is, what decisions they make, and who comprises the committee and non-voting members and liaisons. Next, we'll discuss the details of the decision-making process and types of recommendations the ACIP makes. As diseases and vaccines to control them are being considered, work groups are formed. Work groups are comprised of ACIP members, liaisons, and CDC staff. The work group meets to examine data, speak with experts, and make presentations to broader ACIP members. Specifically, the work group studies the epidemiology of the disease in question, the immunogenicity and safety of the vaccine, the acceptability of the proposed recommendations by both providers and patients, the feasibility of implementing the proposed recommendations, the impact of the recommendations on equity, and the cost benefit on a population basis. The work group and broader ACIP develop their recommendations using an explicit evidence-based method based on the grading of recommendations, assessment, development, and evaluation, or GRADE approach. Key factors considered in development of recommendations include balance of benefits and harms, type or quality of evidence, values and preferences of the people affected, and health economic analyses. An evidence to recommendation framework is used to summarize these key factors. You'll often hear the words GRADE or evidence to recommendation framework in ACIP discussions. The work groups then develop questions for the broader ACIP to consider, and the final recommendations are typically based on those questions. For example, in 2021, 2 new pneumococcal conjugate vaccines were approved by the FDA. The questions that the work group is considering are focused on 2 potential ages at which to recommend the vaccine and whether a combination with a polysaccharide vaccine is necessary. Once all the data have been presented and questions to the ACIP members posed, the voting members vote yes or no, and the majority vote becomes the official ACIP recommendation. ACIP members must disclose any conflicts of interest and abstain from voting on any issues related to the manufacturer with which they have a conflict. The recommendations for a vaccine fall into one of several categories: universal, shared clinical decision-making, and risk-based. A universal recommendation is when a vaccine is recommended for all people who do not have contraindications, typically defined by age. For example, influenza vaccine is recommended for all people ages 6 months and older. This is a universal recommendation. Shared clinical decision-making, which used to be known as Category B, is used when a decision to administer the vaccine is based on a shared discussion between patient and healthcare provider. For example, the recommendation through summer of 2021 is that pneumococcal conjugate vaccine should be discussed with those 65 and older. The vaccine may or may not be given at the end of that discussion, which includes discussion of individual risks and benefits. Risk-based recommendations occur when a vaccine is recommended for people who have certain risk factors. For example, hepatitis B vaccine is recommended for adults with diabetes. These types of recommendations form the color-coded system of the yearly recommended adult immunization schedule. It's helpful to know that vaccines have both a clinical function for an individual patient, as well as a population-based function. The ACIP considers both, but it is more comfortable in the population-based public health area, especially as regards adult issues. The last thing that we'd like to leave you with today are the ways that aging organizations can engage with ACIP, and we hope that you do. These are not the only ways to engage with committee members, but they are excellent places to start to ensure the needs of older adults are represented throughout committee discussions. The first discussion of ways to engage with ACIP is to nominate someone to be on the committee. A committee nomination is for someone to sit in that inner U, a fully voting member of the committee. There is an open call for nominations due each summer. The process is fully outlined on the CDC ACIP website and involves a letter of nomination and letters of support. The ACIP charter requires certain types of expertise in committee members, so it helps to nominate someone who has the qualifications listed and to focus your nomination letter on how the individual meets those qualifications or areas of expertise. A second way to engage with ACIP is to work with the ACIP secretary, the CDC staff lead for the group, to become a liaison organization. Liaison organizations must show that they provide a necessary function in the immunization ecosystem. We mentioned previously that currently the American Geriatric Society is the only liaison organization representing aging issues. They also represent many immunizers of older adults. Think about whom your organization represents and how they are providing a necessary function with immunization. Lastly, and perhaps easiest of the ways to engage, consider providing either oral or written public comment during meetings. The oral public comment process has become a lottery system due to overwhelming demand to make comments. Individuals can register to make oral comments a few weeks ahead of meetings and then are notified if they are selected in the lottery a week or two ahead of time. Remarks may be up to 3 minutes, occur during a specific time on the meeting agenda, and usually focus on something that the ACIP is discussing on that meeting's agenda. For in-person meetings, you must attend in person to make oral comments. While this may change after the COVID-19 pandemic, that has not yet been announced. Written comments can be sent to the email or person designated in the Federal Register announcement about the meeting, which is also listed on the CDC ACIP website. Comments should include a little bit about your organization, who it represents, and why you care about an issue. It's also helpful to clearly state what you are asking of the committee in your comments. Written comments may be shared whenever meetings are announced and typically can be submitted up to the end of a meeting. There are many nuances to running a federal advisory committee, but we hope today that you come away with a better understanding of what ACIP does, who comprises ACIP, and how to best engage as an advocate for the health of older adults. Should you want more information or wish to ask any questions, we have provided the links to do so. We thank you for your time today and look forward to working together to improve immunization rates for older adults.